In my medical training, postpartum and perimenopause were taught as sequential. Postpartum ends, a gap of years, then perimenopause begins. What the epidemiology of women's reproductive timeline is now showing us is that assumption is wrong for a growing number of women, and the clinical consequences of missing the collision are quite significant. The CDC data shows births to women over 40 now outpace teen births for the first time in US history. These are women whose postpartum and perimenopause are not arriving years apart. They are arriving simultaneously, and the medical system is not ready for it. Estrogen and progesterone drop precipitously from the pregnancy highs in the days after birth. Baby blues, postpartum depression, postpartum anxiety, sleep disruption, and brain fog. The expected recovery arc over weeks to months does not happen. What perimenopause does, estrogen and progesterone decline on a zigzagging, unpredictable path, not a smooth drop, fluctuating wildly before the overall decline. The symptoms, anxiety, mood swings, sleep disruption, brain fog, rage, hot flashes, night sweats, hair loss, weight gain, joint pain. Sound familiar? The symptom overlap, nearly complete. A clinician holding both pictures simultaneously will understand the recovery may be incomplete because perimenopause was already running underneath. The breastfeeding layer. Nursing suppresses estrogen via prolactin elevation, creating what researchers call a pseudo-menopausal hormonal state. For a woman already headed towards perimenopause, nursing creates compound suppression. What an accurate assessment requires: a whole full hormone panel, including not just our sex hormones, but thyroid and cortisol. And it must be interpreted in the context of the postpartum timeline, breastfeeding status, and age. The question is never whether she is postpartum or perimenopausal, it is whether she is both. What this collision looks like clinically: the postpartum fog that does not lift on schedule, sleep disruption that persists long past the night feeds, rage that feels older and stranger than new mother exhaustion, a wired and tired that no amount of management resolves, mood instability that does not respond to antidepressants calibrated for postpartum depression. The diagnostic error in clinical practice: the perimenopausal overlay is invisible unless the clinician is specifically looking for it. The average woman in this situation waits over a year before anyone asks the right question, if anyone ever does. For the Gen X woman, you are capable, you handle things, you get it done. Some part of you knew that this story was incomplete. For the millennial woman, you have done the work, and this fog, this rage, this wired and tired that will not resolve, this does not fit any of your existing frameworks because it is not entirely what you think it is. Around 2024, Erica and I had been working together, and we were comparing notes. I was carrying late-stage perimenopause, still cycling, around 53 years old. Erica was describing what she had been calling her postpartum experience. And in the middle of that conversation, the picture just clicked. I recognized perimenopause in what she had been calling her postpartum recovery. Two clinicians, both trained, both had been carrying their own version of this story for years without the complete name. The recognition did not come from a textbook. It came from two women in the thick of it, finally comparing notes. The gap is not education. It is the absence of the right conversation, which is exactly why Women's Well exists. What support looks like at this convergence: the clinical evaluation is really a full hormone panel and a clinician who holds both passages in view simultaneously. Treatment options reviewed in context of breastfeeding status and postpartum timeline and age. The lifestyle changes. Absolutely getting enough protein and fiber, vitamin D and B12, moving every day as much as you can. Building muscle and strength in this window is a clinical decision to be healthy and strong for the rest of your life. It's not about losing weight after the baby, it's about getting stronger. The passage framework. Our masterclass holds the clinical picture and the map that our culture forgot. Our retreat this summer at Sunrise Ranch is the embodied container. June 10th through 14th in Loveland, Colorado. It's 5 days structured around an ancient framework for navigating exactly this passage, mixed with the modern science for your body, for your psychology, for your heart, for your soul. If your postpartum recovery never fully arrived, if the fog persisted past every marker, if it lasted 3 to 5 years, if the rage felt older than your baby, if something structural has been running that no one has been able to name, please join us. And please also go to your clinician and ask them for a full hormone panel and a recognition of the convergence of the 2 stages. Please ask about your perimenopause. Please do not wait another year for someone to ask the right question. The conversation that Erica and I had in 2024 is the conversation you deserve to have now. The masterclass is where we start. The next one is May 3rd. It's free and it's live, and we'll be there. And we hope you will too.